Side effects of pravastatin coming up.
Sunki.
Hi everybody, it's your pharmacist Sunki here. Today we are going to talk about pravastatin. Make sure you stay until the very end so you don't miss out on any important information. Everything I say today is of general nature only. It does not replace the need to see your local healthcare provider. Let me know down in the comments below what other topics you would like me to cover. If you haven't already subscribed to my channel, hit the subscribe button now and thumbs up. Without further ado, let's rock it. What is pravastatin? Pravastatin belongs to a group of medicines called HMG-CoA reductase inhibitors, also known as statins. It is most commonly known as its brand name Pravachol. What is it used for? Pravastatin is used to reduce the cholesterol in the body. Cholesterol is taken into the body through food and also made by the liver. It is needed for our body to make hormones, bile, and vitamin D. There are two major forms of cholesterol: LDL, low-density lipoprotein, also known as bad cholesterol, and HDL, high-density lipoproteins, also known as good cholesterol. Too much bad cholesterol can block our blood vessels and lead to heart attack or stroke. On the other hand, good cholesterol removes the bad cholesterol from the body. Pravastatin works by reducing the amount of bad cholesterol made by the liver and raises the good cholesterol to reduce the risk of us getting a heart attack or a stroke. Pravastatin is also used to treat children and adolescent patients aged 8 years and older who have heterozygous familial hypercholesterolemia, an inherited disorder which produces high blood cholesterol levels. Before you start things that you need to tell your doctor. If you're allergic to any statins that was previously prescribed to you, or if you're allergic to any ingredients listed on the leaflet. Now remember, there's many brands of pravastatin, so if you're allergic to one of the ingredients, you can always ask the pharmacist to try and find you another brand that does not contain that ingredient. Now you need to let your doctor know if you have any liver or kidney diseases or breathing problems. If you're pregnant, intend to get pregnant, or likely to be pregnant, as simvastatin can affect the baby in your tummy. If you are a woman of childbearing age and you are sexually active, your doctor will usually give you a birth control pill to go with it. If you're breastfeeding or intend to breastfeed, pravastatin can cross breast milk and affect the baby. If you're drinking alcohol regularly, as that will increase the risk of you getting side effects, tell your doctor as well if you have pain, tenderness, or weaknesses of the muscle from other medicines used to treat high cholesterol and triglycerides. If you have diabetes, thyroid problems, or any other type of hormonal disorder, central nervous system, vascular lesions, especially if this happened after taking a different type of cholesterol-lowering drug. If you have homozygous familial hypercholesterolemia, a doctor will have to tell you this. And if you're told that you have increased triglycerides. And if you have an organ transplant such as a kidney or heart transplant. If you're of any Asian descendant. I know the doctor should clearly see that you are Asian, but if you are a mixed child, it's harder for some doctor to pick it up, and the dosages of Asian background and a Caucasian is different. Medication interactions. Pravastatin can interact with many other medications, so make sure your doctor and pharmacist know all the medications you are taking. This includes any herbal supplements, vitamins, and minerals that you buy without a prescription from the pharmacy, health food store, or supermarket. Now, if you're concerned that your doctor or pharmacist might miss any interaction, remind them to double check. Now, you can always bring a list of medications to your pharmacist, and your pharmacist will be able to help you work out if there's any interactions on the medication and let you know the severity of it and let you know what to do next. When your medication list exceeds a certain amount and it's hard for your doctor to keep track on all the interactions and side effects, your doctor will request for a specialist pharmacist to review all your medication and optimize the usage of your medication. If your doctor did not initiate that, you can always request your doctor to do so. What strength does pravastatin comes in? Pravastatin comes in 10, 20, 40, and 80 milligram. How to take pravastatin? Depending on your condition, age, ethnicity, and what the medication you are already on, the doctor will prescribe the most appropriate dose for you. The usual dose of pravastatin is between 10 to 80 milligram, taken once a day at the same time every day, usually in the evening before bedtime. Swallow the tablet whole with a glass of water. For best result, take this medicine on an empty stomach, such as 2 or more hours after your last meal. Now, if you forget to take it, if it is almost the time to take your next dose, skip the dose you missed and take your next dose when you are meant to. Otherwise, take it as soon as you remember, and then go back to taking the medicine as you would normally. Do not take double dose to make up for the dose that you missed. This may increase the chances of you experiencing side effects. If you have trouble remembering to take it, set an alarm clock on your phone so it rings at the same time every day to remind you to take it. Things to be aware of. Be careful driving or operating machineries until you know how this medication affects you. Pravastatin generally does not cause any problems with your ability to drive a car or operate machineries. Avoid drinking large quantities of alcohol. Drinking large quantities of alcohol may increase the chances of you getting liver problems when you're on pravastatin. Tell any other doctors, dentists, and pharmacists who are treating you that you are taking this medicine. Tell your doctor that you are taking this medicine if you plan to have any vaccinations or immunizations, especially a doctor that hasn't treated you before. If you are going to have surgery, tell your surgeon or anesthetist that you are taking this medicine. It may affect other medicines used during surgery. Side effects. All medicines, even herbal supplements, vitamins and minerals, things you can buy without a script in your pharmacy, health food store, or supermarket, can have side effects. Sometimes the side effects are serious. Most of the time they're not. You may need medical attention if you get some of the side effects. Now, do not be alarmed by the following list of side effects. You may not even experience any of them. Tell your doctor or pharmacist if you notice any of the following and they worry you. Muscles and joint pain, muscle weakness, numbness, trembling, feeling unusually tired or weak, unable to sleep, nightmares, problems with face muscles, hair loss or change in hair condition, problems with sight such as cataracts or problems with moving the eye, problems with hearing, strange taste, loss of appetite or weight loss, constipation, diarrhea, stomach pain, nausea, feeling sick, flatulence, wind, headache, dizziness, giddiness, forgetfulness, itchy or dry skin, mild skin rash, swollen breast, and sexual problems. Now, the above list includes some of the more common side effects of pravastatin. They are usually mild and short-lived. Now, you must tell your doctor immediately if you notice any of the following side effects. Yellowing of the skin and eyes and dark-colored urine. It may be sign of some liver problems. Feeling weak and tired, significant increase in your need to urinate, significantly more hungry or thirsty than usual. There is a slight increase of risk of getting type 2 diabetes, and these are the symptoms of type 2 diabetes. Problems with breathing, including shortness of breath, persistent cough, and fever. Statins may induce diaphragmatic muscle weakness, causing hypercapnia and shortness of breath, fever, flushing, or generally feeling unwell, tingling in the hands or feet, numbness, sharp pain in the upper stomach, feeling depressed, having signs of anemia such as tiredness, being short of breath, looking pale, frequent and unexplained infections such as a fever, severe chills, sore throat, bleeding or bruising more easily than normal, severe skin rash, itchiness, pinkish swelling of the skin, also known as hives or natto rash, sunburn type of rash after only a short time in the sun, having muscle problems like muscle weaknesses, cramps, stiffness, and involuntary contractions of your muscle. Now, the next lot of side effects that I'm talking about are the side effects that if you experienced any of these, you need to stop the medication and send yourself to the emergency department of the hospital immediately. Symptoms of allergic reactions. This includes cough, shortness of breath, wheezing, difficulty breathing, swelling of the face, lips, tongue, throat, and other parts of your body. You develop a rash, itching, hives on the skin, fainting or hay fever-like symptoms. If you experience any unexpected muscle pain, tenderness, or weakness not caused by exercise, particularly if you also feel unwell or have a fever, if you have brown, black colored urine, there's a condition called rhabdomyolysis where breakdown of your muscles occur. This can lead to kidney failure and death. And these are the symptoms of rhabdomyolysis. Severe skin rash, which may involve blistering and or peeling of large amount of skin. Moldy odor to the breath, problems with balancing and walking, tremor, impaired speech, confusion, and unconsciousness. Now, all these are serious side effects, but they are very rare. More side effects information can be found on the leaflet of the medication. I will also put a link down below for you so you have access to them. Now, even then, the list of side effects there are not complete. New side effects can pop up. So if you experience any side effects that is not listed there, you can always report it to your country's medicine regulatory agency. In the US, it's called FDA MedWatch. In UK, it's called Yellow Card. And in Australia, it's TGA. Okay, enough of the side effects. Now the last thing I want you to do is having all these side effects in your mind and being too scared to take the medication. I want to remind you this is a life-saving medication. Most people don't experience any side effects, and if they do, they are the mild side effects and they're usually short-lived. Many of my patients are on this medication for a long time and they're totally fine. And it's this medication that is keeping them alive. So if you are being prescribed pravastatin, it means that the doctor deems that the benefit of this medication to keep you alive and preventing you from getting a heart attack or stroke outweighs a rare side effects that you might not even get. So listen to your doctor carefully, take the medication on the same time every day. If you experience any side effects that I mentioned before, inform your doctor immediately and take it from there. Now, last note. It is great that we live in a world where we have all these life-saving medications in our fingertips. However, it is not a good thing for us to solely rely on these medications and not do any lifestyle modifications. This medication only controls the condition but does not cure the condition. Things you need to do besides following the doctor's instruction carefully to take your medication daily on time is to exercise, control your diet, reduce fat and salt intake, quit smoking if you are smoking. Now, these are very important to keep your body strong and healthy. Now, work with your local doctor and your pharmacist to achieve that. Now, I have also made a smoking cessation video. I'll put the link down below for you. In this channel, I've also made other medication and health-related videos to help keep your body strong and healthy. It is a growing library of medication and health information. Besides a pharmacist, I'm also a singer-songwriter, music producer, and an actress. If you're interested in knowing my other life, check me out on my other videos in my other playlist. Now, if you haven't already subscribed to my channel, hit the subscribe button now and thumbs up and follow me on Facebook and Instagram. My handle is @SoonKeeOfficial and it's your pharmacist Soonkie here with lots of love. See you around.